Hello then, thank you for joining us from wherever you are. We're coming to you live from our studios here in Kokomlimle. Our digital address GA0992539. Our lead stories this hour. COVID-19 case count steadily increasing, with the latest active cases getting to about 4,000. The Ghana Medical Association is calling for immediate restrictions on mass gatherings, including the funeral of former President Rawlings. We're live with the doctors as they warn against self-medication and call out persons profiteering from face mask sales. Also, the latest discovery that may just reduce COVID infection vulnerability, hydrogen peroxide. We'll talk to leader of a group of scientists who say they found the solution effective in fighting off COVID-19. Also, body of the man who has served as Ghana's president the longest lies in state as Ghanaians file past it. We hear the parting words of some of those who have been paying their last respects. And the Pulse is brought to you by Global Communities Dignilu, affordable, safe sanitation. Do join us on DSTV 421, GoTV 144. We're streaming live on YouTube, and you can join us with your thoughts and your comments on 0540-109009. My name is Gifty Andopia. This is the Pulse, and it's a brand new week. You're welcome. Now, the Ghana Health Service has confirmed that the country once again has active cases of the COVID-19 virus in all 16 regions, with the Greater Accra, Ashanti and Western regions being the biggest hotspots, if you like. In the latest update issued this afternoon, it shows as many as 695 were recorded on the 21st of January, increasing the active cases from 3,286 to 3,525, and a total case count of 61,498. Director General of the service, Dr. Patrick Kumar-Boaje, says Ghana is invoking the full complement of its earlier case management regime to stem the spread of the virus.
Increase the number of tests conducted by the lab has also, because of the response, definitely we need to continue doing the more tests, identify most positive and look at isolating them. Obviously, the non-adherence to the protocol is a major challenge. I'm sure when we've not done assessment, but we're going to start one this week. Ever since people started seeing the surge, I can see the mask wearing is improving. We're going to get our public health labs to run 24 hours. We are opening a new one at Ghana East. I'm sure before the end of the week it will be operational so that more people can be tested. We are also encouraging that if you have a reason to test, even for those who self-elect to go and test, because you feel you are exposed, or because you feel like contact to somebody or whatever, you don't feel unwell, once you have that mind, you need to self-quarantine yourself until you see your results. And that is part of an important protecting your own family and everybody else. So it's very important that once you decide you have a reason to test, you self-isolate until your results come in. To decrease community spread, we will also get in additional centers and remain in high quality. In fact, as we speak today, there's a team out there visiting the lab to check the quality and standard of testing, not just the quality of testing, but also the linkages to the system, etc., to ensure that we are able to respond as a country quickly. We want to do some seroprevalence to see what is happening in the community, which we've started already. And of course, we expand our collaboration with the GES on education and prioritize communication, especially our engagement with the press, to ensure that we are continuing to put the information. And also hope that you also help us provide appropriate information to people to adhere to the protocols. What the protocol seeks to do is to see how we modify so that we can also defy the trend. So we need self-discipline, and we need all of us to also help us enforce this change that we need so that we can avoid the spread of this deadly virus. Thank you very much.
As a Ghana Health Service Director General, Dr. Kuma Abuaje there. Well, this afternoon, the GMA is asking government to, as a matter of urgency, reinforce the ban on social gathering as they warn the public to take their safety in their own hands. Let's get on Zoom. I have Dr. Titus Bayo, who's a Deputy General Secretary of the Ghana Medical Association, joining me. Dr. Bayo, thank you very much for your time. I do have your statement right here, and it states it has about 9 points, which I believe are very crucial to what we're doing right now. I just want you to give us a summary for those who have not seen the statement. Essentially, what we've highlighted is what you're calling for, the ban on mass gatherings once again. But give us a summary of these 9 points you have in your statement.
All right. Thank you very much, Gifty, and good afternoon to your viewers and listeners. I think the import of our statement is just to let Ghanaians know that this condition is still here with us. It's getting worse. Things are not looking so good. And we have asked that, as you said in the 9-point statement, first emphasizing the fact that the situation is getting alarming. We are asking that the government, as a matter of urgency, should try and reimpose some restrictions on mass gatherings. We are also asking that the people should be discouraged from going publicly to join the final funeral rites of our late former president. As many that can join online, TV, social media handles, we think that should be encouraged. And very few people, it should be restricted to very few people instead of opening up for everybody, as we call for a ban on other social gatherings. And then we are letting Ghanaians also know that they need once more, and this has been a consistent feature of our press statement, to take their safety and health into their own hands. There's so much government can do, but much of it depends on us as individuals to be conscious of the presence of this virus and this pandemic in our environment, and be each other's keeper and try to make sure that we obey the protocols on our own so that together we can be safe as a people.
Okay.
I think that is, in a sense, a summary of it.
All right. The first line also indicates that we're looking at an average of 600 cases a day. I found that a bit exaggerated. Help me if I am not getting the sense properly here.
Well, I don't know if you have noticed that today alone, the health service website has been updated twice. And you need to check that. We have maintained that we think that the numbers that are coming up, if we're doing exactly daily updates and we're getting minute by minute when the cases are coming in, this is a region that we'll probably be working in. So that's why we use the word about. It's not an exact figure. Okay. But if you look at it, just follow the trend on the Ghana Health Service website, and you will know that today alone, the updates have been done twice. Okay. So if we're looking, each of them, there's an increasing number.
If we're looking at the rate at which the infections are increasing, help us to understand from a doctor's perspective the extent of pressure this puts on our health systems and on our health personnel.
Yeah. So the fact is, we must know where we are beginning from. We have a fragile health system. The very sophisticated, robust health systems are collapsing under COVID. And for the kind of health system that we have in Ghana and in the developing world, we know that as it is now, our system is being stretched. And I'll just give you a little picture. When this thing started, we had made a call much earlier in March that if we do not take care, this will collapse our healthcare system. One, as it stands today in Accra, people are struggling to get hospital space with COVID. People who should be in hospital are being managed at home.
Dr. Bayo, looks like I've lost you there. Well, Dr. Bayo is the Deputy General Secretary of the Ghana Medical Association. He's helping us with a mental picture of the extent of pressure the number of our infections is putting on the health system. He talks about the fact that from the beginning, we do not have a strong health system. That's number one. And on the back of that, he's talking about how people are being being treated at home. Let me take you to the website of the Ghana Health Service. Let's take a look at the figures that Dr. Bayo was referring to. We'll try and raise him back and get him to, so that we can hear what he is saying. But 695 cases, which is why that is the new cases currently. And he's saying that this website has been updated twice, only today. It's been updated twice. And he's indicating that they actually indicated in their press statement that we're running, or we're looking at an average of about 600 cases a day. 600 cases a day. Over the weekend, there was a point where we had recorded 1,300 cases in 2 days. So, I mean, I was raising an issue about perhaps an exaggerated figure. But if you have 1,300 in 2 days, new infections in 2 days, that's beyond 600, even if it has to be the average. But the Ghana Medical Association is saying that we're looking at about 600 cases averagely in a day. Now, what they're saying is that the situation could worsen. It could worsen. And given the background of our weak health systems, it is not a place that we want to be. And that's why they're calling on governments to reintroduce the ban on public gatherings, starting with the current funeral that we are organizing for the former president, Mr. Rawlings. It looks like we've lost Dr. Bayo, but he makes the point succinctly about people, so many more people needing to be attended to at the hospitals, and the fact that some people have had to be taken care of at home because there isn't space for them. We'll try and talk to him also about what the GMA thinks about the fact that the Ghana Health Service is going back. We're revisiting our initial testing regime. Hopefully we'll get him. But even as the Ghana Health Service steps up the enhanced contact tracing and reinstitutes the mandatory quarantines, as they're saying, Minister for Information designate Kojo Oppong-Nkrumah says government is considering the reintroduction of new restrictions.
We have a limited number of beds and ICU facilities for severe and critical. So it's very important that we ensure that the positive numbers go down. Because if this trend continues, as His Excellency the President mentioned, we will be overwhelmed if this trend continues. Is there the possibility of a lockdown or introducing some more restrictions at some point in time? Yes, there is that possibility. And if this trend continues, that is where we are heading. I want to be very clear about that one. Yes, there's the possibility of some more restrictions being introduced. But especially as this trend is going, if it continues, then that is exactly where we are heading. We are being reminded that we all need to do the things that we're doing in the beginning that would ensure that this third rise, we can quickly curb it. Because the dynamics of this third rise appear to be a bit different from the first two that we had, including the number of people who are falling sick, severe and critical, as we discussed. So, especially if these numbers keep going, average daily new cases of 200, if it keeps rising to 210, 250, then in 5 days you are hitting about 1,000 plus. If it keeps going the way it is going, I think as the President himself articulated, then we are heading for some more restrictions. And if it means reviewing some of the legal instruments, yes, that is where we will be heading.
And that's the Information Minister designate Kojo Oppong-Nkrumah there. Let's go back to Zoom. We have Dr. Titus Bayo once again. Doc, I lost you. You were making a point, I think, about the extent, you're trying to give us a mental picture of the extent of pressure that the number of infections are bringing on our health systems and the personnel.
Thank you for getting me back. I think the critical thing I said was that our health systems are fragile. So we are starting from a health system that is not robust. And if you see very well established systems and what is happening to them, you can tell what COVID will do to our system. Now, practically, as we speak now, our COVID centers are overstretched. And regular hospitals are beginning to have COVID patients in some of the emergency places. If you take the bigger hospitals in Accra, like Kolebu at the teaching hospital, our anesthetists are the anesthetists manning most of the COVID centers in the capital. What this means is that non-COVID cases will suffer. I am a surgeon, I'm a gynecologist. It means that some of my urgent surgical cases will have to be cancelled because the few anesthetists available are the same people who are going to man the various COVID centers across the country. And this is the kind of pressure that it brings onto the system. So currently there are people with COVID who need to be in hospital who are being managed at home because they are struggling to get bed space. And if you take that away, the regular services that we deliver, when this burden is brought to bear on the system, then we are not able to render the capacity that we would normally have delivered to the Ghanaian population. And this is the stretch that it can bring, or it has already brought to our healthcare system.
The government today, or the Ghana Health Service today, has indicated that we are revisiting our initial case management regime. What does the GMA make of that?
It's a call in a good direction. We support them. We need to get back to our basics. We're doing a lot right, and everybody was commending us. And anytime we sounded the caution, people thought that the GMA was exaggerating, or others thought we were being alarmist. But the truth is, we know what we have as a people, and not welcome. So the Ghana Health Service to go back to all the things we're doing before, and we hope that this will be done to the spirit and to the letter, so that we can help stem the tide. It should also begin with the public cooperation. People should realize that this disease is real, it's back with full force, and it's wreaking havoc to our population. And no one should kid themselves that only people with underlying medical conditions are those who are dying from COVID now. Very healthy young people are falling ill and dying. To respond, taking all measures to help us stem the tide. And we really welcome the Ghana Health Service's decision to go back to what we were doing before.
You talk about getting public cooperation. From what we have learned from our previous experience, are there any tips you'd like to share, or are there any lessons that from the GMA's perspective you can share in terms of getting public cooperation? This is something we've been doing for a while, but you still walk around and you see people not wearing the mask. It's as if you have to keep on convincing people. Lessons from your perspective?
Yeah, it looks like what would work for us is an enforcement. And we think if it means a review of the legal regime or the sanctions regime associated with the EIs on this COVID, they should review them quickly. Secondly, we also think that when there is a mass response, when I mean a mass response, if there are restrictions, like we have suggested in our release, and people know they can no longer have their funerals the way they want to have them, they can no longer have their weddings the way they want to have them, then people will know there is want to live a lifestyle our new normal. As it is now, with most of these restrictions lifted, people are of the impression that COVID is not there, and it's difficult reconciling the communication. So we think that if some of these restrictions are reimposed, then people will realize that, yes, this is what we are dealing with. And then the enforcement. We should see people being turned away from the city centers, being stopped on the road and made to go back home when they are not in their masks, or where punitive measures can be applied. That is the only way we can save our Ghana Health Service. We need to save our health system. We cannot overwhelm the system and collapse it. Then we will have nothing to fall on. So everybody must play a role in helping us, and this means enforcement of the law.
In your statement, you talk about PPEs. It was one of the major and outstanding issues that we had to deal with in the previous wave of COVID-19. To what extent has that problem not been solved?
The problem was solved initially with the local production and with China opening up, and there was an opportunity to import PPEs. Now, what we have country from a crisis, from a pandemic, once there's an increase in demand, people begin to increase the cost of these PPEs, which makes it unsustainable for facility owners and government to continue procuring at such high rates. We are asking everybody to put hands on deck. Let's be realistic. Let's not go profiteering with these PPEs. Now, and with a supply system of PPEs, if you look at the number of health workers who are getting infected, it tells us that we need to make sure that these PPEs are readily available. It has improved significantly than when we began during the lockdown era. But with these new cases coming up, there is a need.
I need to sincerely apologize to you, our viewers. We're having a little bit of challenges there with the Zoom. Dr. Bayo, I lost you briefly. If you can summarize what you said previously, or what just went by briefly for me. I was losing you intermittently.
Okay, I think there are network issues.
I think so. I think so too. We can give it a final try and see if we can get the message across.
Yeah. So we are asking the private business persons to make sure that they don't profiteer from this PPE sale at this time. Face masks that were 35 cedis, 25 cedis just a week ago, with the second rise in the COVID, are already going up to 50 cedis per pack, which is not real. If we are encouraging people to use these PPEs, then we encourage those to bring them in. Nothing has really changed. They should not change their prices. Increase in demand should not just mean an increase in price. And we also see a lot of health workers are getting infected. At our last count, over 350 doctors have been infected since the beginning of this COVID. And that means that we should have adequate supplies of PPEs for doctors and other healthcare workers to use in the line of their duty.
Because of our unstable connection, I guess we'll just leave it here. I think that the point has been well made, and subsequently, yes, and subsequently we'll get more thoughts on that. Dr. Bayo there, giving us a mental picture of how dire the situation is, just in case you haven't heard, and the pressure, the immense pressure it is putting on the personnel and our system, which he contends, and you and I will agree, we need to protect. Well, Manuel Quante covered the news conference at which Dr. Patrick Kumar-Boaje spoke about revisiting our testing regime. Manuel is joining me via Zoom. Manuel, there are calls for the imposition of restrictions, including lockdowns even. You've heard the Ghana Medical Association. Was this addressed at the conference, apart from the information minister designates talking about imposition of restrictions, which is rather vague?
Yes, in fact, Gifty, the Minister Designate for Information, was addressing a direct question on whether or not it would be prudent, given the current rise in the cases that we're having, to impose some restrictions and, if necessary, impose a lockdown. But he says that that is not out of the conversation, not altogether off the table. Indeed, it's one of the options that are being considered if the current trend that we're dealing with persists, and for which that's the reason he was calling on all and sundry to make sure that they adhere to the safety protocols so that we're able to stem the tide and reduce the cases. If that is not achieved, then we are in for a possible lockdown, Gifty.
Well, Dr. Kumar-Boaje talked about a sharp rise in cases and how distinct they are from earlier cases in 2020. Now, if we're talking about 2020, we're looking at between March up until, let's say, December or even November. And what we have seen between December and now, which is just about 2 months. Help us understand how he compares the statistics.
Well, so Gifty, in 2020, the cumulative numbers that we had, when you go deep into those numbers, you realize that about just 21.9% of all the cases that were recorded were symptomatic. And by that, I mean people who were coming down with symptoms and might have been severely or critically ill. That picture has changed in 2021, and essentially in just the past couple of weeks that we've been in the year, we're now having 32.4% symptomatic cases of the ones that are being recorded in our health facilities. That gives an indication that the new cases that we are recording are relatively more severe and cause a lot more sickness than the one we're recording in 2020. But he makes a case, and I'll quickly refer to his presentation and quote him verbatim. When he was talking about the reasons for the increasing number of cases, he mentioned that though we have not been able to, as it were, detect the new COVID-19 variant in the community, they have been detected at the airport from international travelers, and there's also been a significant change in pattern of disease spread and severity, which, in his words, suggests there is the new variant in the country. He was quick to, however, emphasize that there are further studies that are being conducted to be able to ascertain the sort of penetration within the community as a whole of these new variants, and that's been the picture. Having more, severe and critical cases this time around than when we had, the situation in 2020.
We'll help our viewers much more when we put the figures together and put it on the screen so they can follow the trend and make it easier for them to appreciate the extent of the problem we're dealing with here subsequently, Manuel. But he talks about the concentration of these infections. We're looking at the Greater Accra region, the Ashanti region, and the Western region. Are there any other regions that come close, or, did he give reasons why we're seeing at least the surge in these three regions?
Well, so you'd had the Yuletide season, which was the latter part of the year, 2020, when we had the Christmas festivities. And so a chunk of the cases that we are recording are being attributed to what they describe as the letting down of the guard of a lot of people who went to parties, end of year functions and so on and so forth, without necessarily adhering to the COVID-19 protocols. And that's the reason for the surge. The concentration is within the Greater Accra region, which has more than half of the cases that we currently are dealing with. The Greater Accra region alone has more than 50% of all the cases that we are currently dealing with. I'll give you the specific numbers. The Greater Accra region alone currently has 1,945 of our active cases out of a total of 3,525 cases. The Greater Accra region alone has 1,945 cases, which, according to him, is really alarming, and a reason for which most of the people within the Greater Accra region must begin adhering to the protocols. And I think that it's quite instructive to note also that the Ghana Health Service says that it will be embarking on another study to establish the sort of adherence and compliance to the wearing of face masks. And you remember that the West Africa Center for Cell Biology and Infectious Pathogens work paper, the University of Ghana, conducted a survey which said that a lot of the people in Accra were not wearing their masks. They had gone down way below 44%. And he says, and I'm referring to Dr. Patrick Kumar-Boaje, says that the past couple of days where we've been having the surge, there's been a sort of a change in attitude where a lot more people are adhering to the wearing of face mask protocol. But a definite study will, as it were, establish the extent of compliance. Gifty.
Okay, just a final one on the vaccine. Did they give us any updates?
Well, we knew over the weekend when the former Deputy Minister Bernard Okuboy spoke on Newsfile that there were talks that had, far advanced with the COVAX platform to get Ghana some of the vaccines. But the question that we put to him, I'm talking about Dr. Patrick Kumar-Boaje, is about the efficacy of such vaccines, even if they are imported into the country, given the fact that we know that in the UK, for instance, people who have taken the jabs are still transmitting the virus. And again, with the new strain and variant of the virus, there's a cause for concern as to whether or not this this vaccine is able to deal with that. But he says that currently there is no evidence to suggest that the vaccine, which is currently in circulation in other parts of the world, cannot deal decisively with the new variant. And so it was to be seen the extent of efficacy that we'll have with that vaccine if we get it. But the timelines are still the same as have been communicated to us, and we're hoping that it gets here, Gifty.
Manuel, thank you very much. Manuel Quanting covered the press conference held by the Ghana Health Service with the Minister for Information designate. Now let's talk about something that might just be a little bit of a good news. Well, former Provost of the College of Health Sciences of the University of Ghana, Reverend Emeritus Professor SETH AYETTEY, has disclosed that hydrogen peroxide prevents COVID-19 in a report that's made available to JoyNews. The highly reputable professor indicates that empirical evidence has shown many people were effectively prevented, or the experiment saw that a number of people could not be infected by COVID-19 because they were using the chemical. I'm going on Zoom to join Reverend Emeritus Professor SETH AYETTEY so we can break it down a little further and see if this will pass the test or the tests necessary. Reverend, thank you very much for your time. Good afternoon.
Good afternoon, Gifty, and good afternoon to your viewers.
So I have... You wanted to say something?
Yes. First of all, I would say that we should follow the protocols that government, has put in place, and the president has several times emphasized. We want to make a contribution that we think is very significant. And I know some are willing to try it, but others are saying, why should we believe you? So if you like, I will start with that, because I think it's very important.
Yeah, why should we believe you is a very important question to answer. First of all, this is about people's health, and that's why I talked about the tests. But I'll come to that. I just want you to summarize for us. Usually what happens is that we have the document, but we need to understand what you found. Your document here, as I have read it, tells me that you conducted some sort of experiment with your team members, and they used
No, just let me correct you. We didn't conduct an experiment. We did a literature review, literature search on relationship between hydrogen peroxide and coronavirus. And the literature is very, very strong on that there is a definite relationship. That is an in vitro study outside the body, and shows that hydrogen peroxide inactivates. In other words, it destroys the coronaviruses, whether it's the Middle East respiratory syndrome or the first SARS or this new virus. And then the literature also says that the hydrogen peroxide inactivates also influenza virus and all other respiratory viruses. That is significant. And if anyone doesn't want to believe anything, then believe what the literature has said.
Very well. So, Doc, Prof, let me just refer you to this part of your statement. It says, based on the science, team members and their families and friends started using 1% hydrogen peroxide for mouth washing and throat gargling to establish evidence of protection from the virus. When team members exposed to COVID-19 patients tested negative for the virus and remained healthy, we were encouraged to share the use of this oral cleansing agent with several others. The daily graphic reproduction of the above article is now also being cited worldwide. So this is the part of your statement that I refer to as the experiment, is it not?
No. Science includes literature survey to convince yourself that what you are doing is scientifically proven. You understand that? That is why I wanted you to listen to me and your audience as well. Then you can follow exactly what I'm saying. So I'm saying that the literature, the science that has been done clearly shows that coronaviruses are inactivated by hydrogen peroxide. That is number one. Number two, the hand sanitizer that is used contains alcohol and then 3% hydrogen peroxide as well as glycerin. And this is the WHO approved formula. So what we rub on our hands and what we use to clean our tables and so on contains 3% hydrogen peroxide. That in itself is part of the science. And it tells you that hydrogen peroxide is critical in dealing with this virus. Now, the third reason why people should believe what we are saying is from the observation. That is why I said that based on the science, we ourselves, because when you are doing observational research, quite often it's likely, it should start with you. So you do the experiment, you use the peroxide and put yourself in various situations and find out whether you will get the disease or not. And a number of our colleagues in the research team who work in health care institutions, have been using hydrogen peroxide. None of them has come down with the disease. But that certainly is not conclusive at all. What we also observed is that a nurse who works at the Dodowa District Hospital, the Shai Osudoku District Hospital, came to me at a meeting, and she said, "Prof, I've just nursed a COVID patient at the hospital, and the diagnosis came at the very time that the patient died." So I said, "Well, how long have you been with the patient?" And she said 5 days. And I said, "All right, aside from praying with you, I'll ask you to use hydrogen peroxide, because you see, when the virus enters the body, enters the mouth and the nasal cavity, it stays there for about 5 days before it penetrates to now cause infection." So she said, "Oh, I've been using hydrogen peroxide," and that was introduced to her by her husband. And so I said, "All right, continue to use it. I will follow you up daily for 14 days to find out whether you will get the disease or not." And then I asked her, "What about your colleagues?" And she said, "There are 7 other colleagues who are also using hydrogen peroxide." So I said, "Fine, then I'll follow all of you. After 14 days, let me know whether you've contracted the disease or not. And then follow up with the test." All of them tested negative. That is from June, middle of June. Then I found out from the director, and the director said 20 of their staff had contracted COVID by then. At the end of the year, by December 2020, 62 of their colleagues not using hydrogen peroxide had been infected. And the 8 of them using peroxide had been protected. So just from the observation, aside from the many that we have shared, the concentration of hydrogen peroxide and how to use it with some of whom we followed and who are saying that they've not had the disease, this one wakes us up. Even as researchers, we've done a paper, a protocol for more formal studies, but this one wakes us up, and we've been doing this from March till now. So this is the time, now that the cases are going up, now that people are dying, now that we're having more admissions and the burden on our health system, this is the time to bring that also up, because it is proven that hydrogen peroxide is effective. Hydrogen peroxide is used as a mouthwash, for oral hygiene. We've all used it at maybe one stage or other. And so, in addition to what government is doing, why don't we try this? Especially since we have some evidence that this thing works. Why don't we try it? That is my question.
Try it. How? I just want to find out whether you and your team have submitted this, for example, to the Ghana Health Service, so we can standardize it.
Yes. I think as far back as September or so, we submitted in the proposal to the Ethical and Research Review Committee, and they looked at it. They agreed with us that we should do observational studies rather than double-blind study, because we're dealing with life and death here. and they raised some questions for us to address. We've been addressing that. In fact, the revised version of the protocol is ready for submission.
So as we speak now, the Ghana Health Service has not necessarily standardized it for people to apply.
Well, let me say that we would welcome a meeting with the Ghana Health Service as such, not just the Ethical and Review Committee. We will welcome such a meeting with them. But because hydrogen peroxide is known to inactivate the virus, why don't we let people try it? Unless one is telling me and the rest of my team and the rest of the country that hydrogen peroxide should not be used.
Well, that's a question for the GMA to answer, I believe.
Well, the
Ghana Health Service, I meant to say.
Oh, okay.
Right,
okay.
to answer, well, because then that steps up the level of trust that people can have in this.
Yes, Gifty, we are dealing with a serious problem. And this article that we published in the British Medical Journal was reproduced by Daily Graphic. I think it's important for all of us to work as a team so that some people would even call us and say, look, let's sit down and discuss this thing that you what are the benefits in it for us? How can we work with you to formalize it so that we can use it? Because it's not only in Ghana. Hydrogen peroxide is also being used, elsewhere, and we are saying that even COVID patients who are now coughing and releasing the virus, if we give hydrogen peroxide mouthwash and gargle to them, the viruses they shed will be inactivated viruses, and therefore contacts will be protected. And we will suggest to the Ghana Health Service that for all the contacts, if they will map out the hot zones for all the contacts, they can include, together with all other protocols, the use of hydrogen peroxide. And let us see. I mean, if 8 nurses who are frontline and who are wearing ordinary scrubs plus face mask and gloves and looking after COVID patients for 9 months, and who have not contracted the disease, who have been negative for the virus, why don't we try?
Okay. Why don't we try? Doc, by the way, this is like, from the way you describe it, something that we usually would have as a mouthwash at home anyway.
Exactly.
All right.
Exactly.
Okay. So, Prof, we'll leave it here for now. Unless there are any quick final words you want to add, that's it for me as we wait to hear from the Ghana Health Service on the back of this.
Yes. One of my colleagues on an international platform, he's an American. He made a statement recently that in his view, if the whole world would, over a period of 2 weeks or so, use hydrogen peroxide, COVID will be over. It's as strong as that. It is as strong as that. And then secondly, hydrogen peroxide deals with it will deal with all the variants. Just as it deals with MERS virus, it deals with SARS virus, it deals with SARS-CoV-2 virus, it will deal with all the variants because the mechanism by which it works, destroying the membrane wall, the lipid membrane wall of the virus, and disrupting some of the protein receptors, is the same mechanism.
Okay. Prof, I'll say a very big thanks to you, Reverend Emeritus Professor Andrew SETH AYETTEY. He's a leader of a team, a team of scientists that says it's discovered that hydrogen peroxide helps in reducing the vulnerability to COVID-19 infections, and he's encouraging people to, and this is contained in mouthwashes. He says that some of the treatments that have been lined out for COVID-19 contain the same chemical as well. What he's waiting for is now for a meeting with the Ghana Health Service, which he says has started, a meeting with the Ghana Health Service that sort of standardizes this for use. But he says nurses who were exposed have all tried it, and those who used the hydrogen peroxide came out negative even after being exposed to positive COVID-19 cases. Let's talk about frontline health workers. They would be the first beneficiaries, we're told, of the Ghana coronavirus vaccination distribution and administration. President Akufo-Addo last week said the government has concluded a technical committee discussion on the vaccine and awaiting action. Speaking on Newsfile last Saturday, former Deputy Health Minister Bernard Okuboi, Dr. Bernard Okuboi, indicated that the country has applied to a World Health Organization platform to access the vaccine, which is suspected to be available in the next quarter of this year. He's been disclosing the priority list for the vaccination.
What we are doing now is that there are two routes. There's a global platform that has been created by WHO called the COVAX facility. COVAX means that it's coronavirus access platform. And they are allowing low to middle income countries who might not be rich as the West to access this platform. You can get 20% of your population needs. So 20% of our population would be given to us, more or less through a special arrangement, like a grant. But the rest of the 80%, you have to pay yourself. Now, so we have applied to that platform. They would start disbursing first quarter to countries that have applied. But we are also exploring the bilateral route. So top government officials, I know my boss, my former boss, the Minister for Health, is talking to some of the manufacturing companies. Ghana is looking at buying some directly also. And then as we speak, there's a technical committee to look at the criteria for the rollout. Who gets first? What is absolute is that health workers are very high on the list. And then secondly, people have mentioned the security services because of their mixing with populations outside the country on operations. I also know that elderly people with who can prove underlying conditions like heart disease, kidney and all that, and people with a high turnover rate for meeting others like transport operators, people who meet a lot of people in a day, teachers who have to go and mingle with kids and all that. So we are looking at it very seriously.
Okay.
As the former Deputy Health Minister, Dr. Bernard Okuboi, let's hear a pharmacist and fellow with the Center for Democratic Development Ghana, Kwame Sapon-Siedu, who says the country is at risk of recording more COVID-19 deaths if serious efforts are not made to ensure strict compliance with the protocols.
Us to take our personal health responsibilities seriously, to start with. The wearing of the mask is no longer a fashion statement or luxury. It is a life and death necessity, and we all need to do that. Then the government has to also realize that no country has citizens who by default are law-abiding. Humans by nature are lawless and reckless. In societies where lawfulness persists, it's because modalities are put in place for lawfulness to persist, and people are willing to enforce the modalities that ensure lawfulness. We need to do that as well. And I have seen footage of the police arresting people yesterday who are not wearing face. For COVID, the herd immunity threshold is 75% because it's 3/4, which means for Ghana, a population of 31.3 million, you've got to immunize 22.75 million people to hit the herd immunity threshold. That COVAX is giving us up to 20%. Bernard said 20%, but if you read the the memorandum, it says up to 20%. I am also aware that Serum Institute are having challenges with the Indian government because the Indian government is saying that unless half their population has been supplied, they are going to constrain supplies from Serum Institute to COVAX, and therefore the distribution is having some challenges. But hopefully, I'm quite sure that that will be addressed with the government of India. But that said, the 20% is 6 million Ghanaians. And we have to inoculate 22.75. So we've got 16.75 million vaccines that we have to source from elsewhere. I'm glad that they have put committees in place to do this. Morocco has signed a bilateral with Sinopharm China to, get stocks of Corovax, which is the Chinese vaccination, the vaccine. Ghana can go down that route. But the biggest thing is for us to learn as a country that we cannot continue pussyfooting when it comes to vaccine research.
So, Kwame Asiedu, they're making the point that Ghana has to be a part of the COVID development if we want easy access, despite what our money can buy. Well, the police administration also last week arrested hundreds of people here in Accra and parts of the country for not wearing the mandatory face mask, despite calls for a review of the sanctions. Dr. Dominic Ayene is a member of Parliament for Bolgatanga East. He is supporting the call for a review of the law. Is
it time for a review? I think it is time for a review, okay? Because, you know, the life of the law is not just logic, it's also experience. That's right. So we have experienced the implementation of the Imposition of Restrictions Act and the pursuant executive instruments that the president has passed, all right, up to this point. What you showed, the clips that you showed, and your own interview on the street shows that this regime will not work for us. So we need a more humane regime. Maybe the whole municipality example that you gave is something that we need to take up very, very seriously. So we probably need to look at the sanction. I think it can be sustained, right, if we commit resources through the assembly, you know, for provision of masks, you know, probably on a monthly basis. Okay, if we make quarterly allocations towards the procurement of masks for households, reusable ones, like we did for the students, right? I think you know is doable. We were not too poor a country as not to be able to afford to do this. I think we can do it. Yeah.
How urgent do you find the need to review this?
I think we should. I think we should be looking at it immediately. I think we should be looking at it immediately. And given what I have seen, you know, I would probably begin discussions with my friends on the opposite side about whether or not, if the president is not bringing a review, you know, of the law, we can start something by way of a private members bill.
COVID-19 is still real. You're watching The Pulse with me, Gifty and Opia. Let's take a very quick break here. We'll return shortly. We'll also talk to you about the laying in state of our former president, Mr. Rawlings. Do stay with us. We'll be right back. You're welcome back to the show. Many thanks for staying with us. Now, there's growing resentment among caregivers at the Komfo Teaching Hospital over the management of COVID-19 cases at the facility. 8 confirmed cases have been recorded at the Child Health Directorate in the last few weeks. The caregivers accuse management of putting their lives at risk as suspected COVID-19 cases are managed alongside other patients. Ohim Interior with more in this report.
Doctors and nurses at the Komfo Teaching Hospital's Child Health Directorate say there's no concerted effort by management to either test staff who come into contact with COVID-19 cases or close down wards for fumigation.
We have been told that we cannot refuse care to anybody. So I think our facilities are doing their best not to return anybody who walks into the facility being ill, and by so doing they are also increasing the exposure rates of every other person around. It's been almost a week now, but nobody has been called or contacted about testing the staff nor the relatives. A lot of us are embittered by it. We keep complaining, we keep passing comments, but we can only talk in the background. If there is anything that can be done, it is about management helping us out.
A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She says the development puts their immediate families and that of the public at risk.
There has been a clear line in that we should have frontline health workers who have been trained specifically for the management of COVID-19. But as it stands, it looks like every health worker is capable of managing COVID-19 at any little space on the ward, which is not supposed to be so. it exposes both the patient, the health workers, as well as the relatives who come around these patients. And it makes managing COVID-19 quite difficult, because we know that COVID-19 should be managed, 1, in an isolation, 2, by trained professionals, and 3, with specific PPEs. And all these 3 things are being lacked. We initially had suspected, and getting results was a problem. Finally, when they became confirmed, we had to manage them on the ward, because as we are being told, there is currently no trained personnel and no specific place to keep those patients. So they were being managed on the ward. When in the first place, we don't even have social distancing on the ward because the wards are full. We had to manage these patients side by side with the average normal sick patients.
According to her, caregivers are appalled by the failure of management of the hospital to close down affected wards for fumigation.
Ideally, the ward should have even been closed down by now, once we got to know that there was a patient who had been on the ward and the exposure was to virtually every nurse and doctor, because for 3 weeks, every nurse would have had contact with the patient, so that these nurses could have been given an isolation plan at home with prophylaxis. And then, if possible, each nurse should be tested. And then based on the test, we would know who can return to work and who needs to stay home. Since we've had an increasing number of 8 in just 2 weeks, the probability that we may record more in no time was possible, and so we should be prepared for it. It's quite traumatizing and scary.
Management of Komfanoche Teaching Hospital has expressed concerns over the issues raised and promised to respond at the appropriate time. From Kumasi, for JoyNews, AYETTEY reporting.
He came across as a nationalist, selfless, incorruptible and fearless, and disciplinarian. As the nation bids Flight Lieutenant Jerry John Rawlings farewell, some of his classmates from Mrs. Sam School at Nima and Achimota say he stood up for the defenseless and became a voice for the voiceless, even at a very young age. But beyond the uncompromising face was a man full of humor and never rejected a dish of kinky and fish. Former Chief of Defense Staff Brigadier General retired Joseph Nunu Mensah and a few close friends tell us more.
In this exercise, you're testing some new cars, armored cars we have bought. And he was flying one of the planes that were given what we call in the military close air support. They would come and bomb the enemy across the river, and it was a military operation. One of the pilots was flying almost on the top of the trees. Very scary. So I said, who is this crazy pilot? I mean, behaving as if he didn't care for his own life. So at the end of the exercise, I tried to find who he was. And I got to know it was this Sergeant Rawlings. That I began to take interest in him because his bravery was no, I've never seen it like this before.
Jerry stood out in the class, not because he was a naughty boy or notorious boy, but he seemed to do things his way, in the sense that he loved to ask the teachers questions. And the questions came, now I'm an adult, I can analyze them easily. They came in 3 different types. One was a straightforward question. The second was the kind of question that would stump the teacher. And then the third type of question was when he would do his thing, you know, like his acting, his arms all over the place and his face and things. And it would be a rambling question. But because of those questions, the class got to notice him, that he was different from the rest of us. You know, he was noticed by the teachers.
He was very charming, very laid back, and pensive at times. You weren't sure what was going through his mind.
It was a joy flying with Jerry Rawlings because he would always maintain his position. Because the thing is that follow your leader, and he will always follow and get glued to his position.
He was sending a message to ordinary Ghanaians that we don't have to wait for the IMF, for the World Bank. We have what it takes to rescue ourselves from this morass. And that's what he did.
Well, his body has been laying in state at the Accra International Conference Center. Let's take you there, where JoyNews editor Araba Kumsing has been monitoring activities relating to the funeral of the former president. Araba, what can you report? We're told that the body of the late president was conveyed to the center as early as 5 a.m.
Since the crack of dawn, we've been here as the former president's body was laid in state for members of the public to come and pay their last respects. In fact, today, earlier in the morning, members of the NDC as well as the MPP, leadership of those two political parties, were here to pay their last respects. And so it's been a somber mood throughout, because obviously this is a man who was loved by the people, described by many as an icon and a man of the people. This was someone who, speaking to a lot of people, a lot of things that they say, one thing stands out, that he was a man of the people. He was someone who desired to bridge the gap between the rich and the poor, and that can never be forgotten. So earlier today, we had the leadership of the NDC, as well as members, the grassroots members, coming in their numbers to pay their last respects. And a lot of them talk about the principles that he espoused, and those are probity and accountability. We all know those principles. It's very, very common now for most of us. But for many of them, we need to instill these in our governance structure, because that is what is missing in our governance structure. That is what Mr. Rawlings came to espouse, to change the democratic system. But it seems that we are going back rather than, moving forward. And so we've been here since the crack of dawn when the body was brought here. There was tight security here. COVID protocols were strictly enforced. In fact, they don't allow media men to go inside the foyer where the body is laid. And so we are expected to, beam the pictures from a media village right behind me. But generally, it's been a somber mood. People come here, they go in there, look at the body, and emerge with tears in their eyes. Some screaming and crying because they still are in shock and cannot believe that this colossal figure is gone, finally. But I've been speaking to some members of the NDC, most of whom we don't hear from nowadays, but most of whom work closely with former President Rawlings. And what they tell me is that he was a tax master. He was someone who held you to high esteem and expected you to work at your highest. I spoke to Hudiyaya. I spoke to Hudiyaya, who was a former secretary during the PNDC era, as well as Kofi Totobi Kwache, who was the information minister during the Rawlings administration and later became the national security minister, the first national security minister. And they've all been talking about the need for us to espouse the principles of probity and accountability, for which Mr. Rawlings will forever be remembered for.
Environment within which Jerry Rawlings emerged. And in a period of about 10 years, he managed, under his leadership, things changed in this country for the better. And it set this country on the path of good governance, of economic stability, of political stability. And what we have today is a credit to the leadership that he provided this country. And I walk in there and I see Jerry lifeless. It reminds you that everything has an end. For a man who was so active, so buoyant, to to see him in this state, I know that all of us at some point will go, but nobody fathomed that Jerry will go at this time. And sad as many of us are, I also think that that he's accorded this respect, he's accorded this honor, and that people are now speaking out in appreciation of what he did. It proves the saying that posterity is what will judge us all. Because when I listen to some of the people who in the past had demonized him, people who had referred to him as a murderer, people who misunderstood circumstances or issues that had arisen and were easily described him in unpalatable terms, that today I sit back and I hear them talk in such effusive terms about how good he was, what a good person, leader he was, this thing. I say it's a lesson for all of us. Don't let us rush to judgment.
It's interesting you talk about that, because even as we mourn him today, we are also celebrating him. For you, what is the legacy he leaves behind?
For me, the legacy he has left behind is the stability that this country is enjoying. There was a time when coup d'etats were the order of the day. And I remember on 31st December 1981, one of the announcements that was made following the takeover was that this is the coup that will end all coups. And I think those words, those prophetic words were uttered by then Naval Captain Asasi Jima. And truly, we started, there were issues, there were attempts, etc., etc. We prevailed, Ghana prevailed, and today we talk about Ghana as the bastion of democracy. Today we talk about Ghana as an example of stability. Today we talk about Ghana as one of the finest examples of economic development and progress. I think that Jerry has gotten the honor that he deserves.
I'm sure a lot of memories are going through your mind as you see the lifeless body of the former president lying there. What are some of those memories?
Well, it's a very sad day for the nation. JJ was such a huge figure in our whole political scene. And as I said in my tribute, you know, when a man attains such a huge stature, we get very used to it and imagine that somehow the laws of biology wouldn't work with him. So, but it is sad that it happened, and happened so suddenly. I think that the nation will remember him as someone who was so dearly loved, especially by the ordinary man who saw in him someone who really spoke for the ordinary person, and someone who provided leadership, very critical leadership, at a time when the nation was almost literally on the brink of total social disintegration, and provided leadership, especially in the area of economic policy transformation, and leadership in helping us take decisions that needed to be taken, even though they were painful and cost him some political, some of his political liking, and so I do very much hope that the cardinal principles that he stood for, probity, accountability in public life especially, will be taken seriously. These are all values that it would appear are being eroded with time, but I hope that this will provide a certain reawakening of the whole nation to appreciate, the true values of the probity and accountability that he so much cherished.
Now, Mr. Rawlings has been credited for turning the economy around at a time when it was in a dire state, and you were pivotal in that and very instrumental at the time. So tell me, what do you remember about working with him during that time?
Well, the most difficult problem we had at the time was to change our policies in the area of our exchange rate management. The cedi had been pegged at 2.75 cedis to $1 for a very long time. Everybody knew that this wasn't the true value of the cedi in dollar terms, but all our political leaders and frankly every government that had tried to realign relative prices and to touch the peg that we had established for the cedi to $1 had met with some political misfortune. So it took a lot of courage. And JJ, I worked under him for 13 years. I was his minister. And I know firsthand the kind of leadership that he provided at some political cost to himself in taking those policies and in shifting our stance on the exchange rate management and gradually allow the exchange rate to be market determined rather than administrative determined. And it provided a foundation, a real foundation for the institutional changes that needed to be made to make this economy what it is today. We take a lot of things for granted today, the forest bureaus and all that, the stock exchanges and all that.
Well, that's Araba's conversation there with Professor Botche. Well, she's also been speaking with Hudu Yaya, former PNDC secretary.
Yes, and Rawlings will want justice from the coast to the north. No discrimination. The country's resources belong to all. So for us as a country, a people occupying public positions should not tolerate ethnicity or tribalism in the negative sense. No, don't. Don't discriminate against others because of where they come from or because of the language they speak. Don't discriminate against people because of which religion they practice. We are all Ghanaians. That's first and foremost. After that, whatever anybody does, that's his problem. This is what I learned about Rawlings.
From the interviews that I've conducted this morning of the leadership of the NDC and other members of the NDC, what stands out a lot is the core principles of probity and accountability which he drove. Do you think that is still alive in the party now? It's alive.
It's alive. It's alive. As human beings, we can never be perfect. As a society, we can never be perfect. But there's always room for improvement, and that is what keeps society going. The NDC will cease to be NDC if those values are lost in NDC. I
asked that question because Mr. Rawlings himself, before his death, had cause to complain about the fact that these principles were not being upheld in the party.
Well, I don't remember which particular occasion you are talking about. But the point is that even though I don't remember, even though I don't know which particular quotation you are making, I don't know which particular quotation you are making, but I want to say that no society is ever perfect. At least we were better than where we came from. At least after June 4th, something has been integrated into our society. That if you are given any public leadership and you are going to do what is not right, you are going to be corrupt, at least you will be looking at your back. You wouldn't do it with such brazenness. If what we are not able to achieve, what we have to ensure is make sure that we leave something behind that the generations can build on to improve it, and that's how society goes. If you look at the countries which we call, countries today that are supposed to be developed societies, they are also still improving. Who would have thought what happened in America would happen after 200 years? So I am saying that if he had cause to do this, he had the right because he was our leader and he was our founder. It means he still wanted us to improve upon whatever he had left behind.
And finally, I mean, as you were walking past his body, lying lifeless in the casket, what were the thoughts running through your mind?
Terrible. I will tell you, terrible. When I was entering here, my prayer was just that all what we were hearing from 12th November was not true. Terrible. Terrible, I will tell you, my dear sister. And I kept communicating in my heart to him that we shall continue to uphold, catch him, that we shall continue to uphold, that we shall continue to uphold whatever principles that he left with us, whatever principles he trained us in. You know, I have worked under him as a deputy PND secretary. I've worked under him as deputy PND secretary for the Northern Region. I've worked under him as PND secretary for Northern Region for 7 years, the longest 7. I've worked under him as PND secretary for Labor and Social Welfare, which was called Mobilization and Social Welfare. I've worked under him as Trade and Tourism secretary. I've worked under him as PND secretary for CDR. I've worked under him as CDR, general secretary, and I've worked under him as vice chairman. Catch him, please. I've worked under him as vice chairman, and I've worked under him as member of Council of Elders, and he was our chairperson. So you see that the greater part of my life has been with him. I have no reason whatsoever to depart from whatever he stood for, which I fought together with him. All right, I'll leave you to catch.
Thank you very much.
Well, Araba comes in with Hudu Yaya there trying to, get hold of Mr. Zotobi Kwachi earlier there. We'll be hearing from the NPP's chairman, Freddie Blay, who has also been paying his last respects. But just a few messages some of you have been sending through. It looks like most of you sent it at the time we're having the COVID-19 conversations. And it does look like a lot of you are interested in the hydrogen peroxide and how it can help reduce the vulnerability to COVID-19 infections. Well, before I go into that messages now, we can listen to Mr. Freddie Blay.
Past the body of former President Rawlings lying in state there, what were the memories that went through your head as you looked at his lifeless body?
Mixed feelings, let me be honest with you. Here lies a very pleasant man who is gone. He had the longest reign in this country, both as a military leader or a revolutionary leader, and then of course as a civilian ruler too. Think in a greater percentage of some of us, our youthful light, he was the man who was at the reign of affairs in this country. So I will say, if I want to be very gracious to the memory, say that it's had a big impact on the life of this country, political life in this country. Of course, economic-wise, honestly, this country still remains what it used to be. Not much has changed. It means we need to take a second look as political leadership of not only Ghana, but of greater percentage of Africa. Is it the leadership of an individual, or is it all of us together moving forward? But of course, moving forward, we need leadership. And I believe that the role he had played about 30 years of Israel in this country.
Of course, he was one of your biggest political opponents, but there are many who say that his impact cannot be forgotten. You agree?
Exactly, that's why I will come here. If I do remember, I've been in prison for at least a year in his reign. But I'm here today. That's history. At the end, till end of even when he was living, not as a leader, I could manage to converse, not only with him, but even more so with the wife. Was very pleasant, passionate, and could express his feeling. So we all need to come together, forget about the past. When we have the opportunity, we must be very, very, very measured in what we do, how we conduct ourselves, and then should not be too hard on our opponents. Because at the end of the day, we will end up what has happened.
Many talk about how he instilled the principles of probity and accountability into our governance. In your own opinion, what legacy does he leave behind?
As I said, I did phrase what I did tell you, that it's with mixed feelings. Probity and accountability was not invented. It's been there. Maybe he emphasized it more in terms of rhetorics. But this country still remained. Corruption from Adam to now, it's a problem the society has to face and deal with.
But you can't deny the fact that he tried to instill some integrity into our governance system.
I've not denied that. As a leader, he tried his best to do that. But as I said, these things have outlived him, as I talk to you now. So we as a society, it's not a strong personality, but strong institutions we need to build for our country. So that we don't believe in individuals that they can give us examples and leadership that will last forever. America even sometimes could even experience attempted coups and so forth and so on.
The NPP's chairman, Freddie Blay, there. Let me take a few messages so far. This one says, James from Sunyine says, please, how do we prepare our own, hydrogen peroxide is what you're talking about, to be used. Thank you very much for your message. This one says, even though he's lying in the casket, I still don't believe Papa J is gone. May his soul rest in peace. Thomas from Nalerugu says to ask Professor the percentage of hydrogen peroxide recommended for mouthwash per their research. Well, he's talking about mouthwash that's already, I think, on the market. Some more of your messages here. Dr. Kwejo Yelaj says Rawlings has done and sacrificed so much for our dear republic. He ended up in a coup d'etat and gave birth to the Fourth Republic. He remains Ghana's most charismatic leader. Another Fourth Republic. My condolences to the bereaved family and Ghanaians. You're texting from Kintampo North Municipality. Well, just a very quick one before Gary steps in with sport. And waste management company Zoom Lion, which has been disinfecting airports, schools and the markets, is launching a campaign to disinfect community and institutions for free. Lola Ashite is the coordinator of the Jospon Free Community Disinfection Program. Ms. Ashite, thank you very much for your time. Let's start with why you are undertaking this campaign, although it might sound pretty obvious. Hello, Madam Ashite.
Hello.
Hi, I do hear you. I was asking why you are embarking on this campaign. It might sound a bit obvious, but do give us a brief reason why. Hello?
Yes, hello, I can hear you, but faintly.
Okay, let's see if we can try this once again. If you do hear me, do tell us why you're embarking on this campaign.
Okay, so Zoom Lion is putting together a campaign that started on Saturday. We are looking at disinfecting all interested organizations and individuals for free. We just looked at the rising figures for COVID-19 positive cases, and we decided to give back to community. And so the Jospon Group and Zoom Lion together have put aside 2 million Ghana cedis to disinfect households and organizations that will not be able to pay for same. And so we are open to individuals and organizations who are interested in having us disinfect their facilities for them. And this is not only Zoomline, it's the entire JoyNews group. And so we are looking at making sure that Ghana is able to combat COVID-19. We're looking at reducing the cases. And so all interested people can call and then have their houses, their individual homes, compound house, schools, churches disinfected.
So let's take a look at people who are interested and how they can be beneficiaries. What are the processes?
Come again?
I'm asking what are the processes for people who want to be, organizations who want to be beneficiaries?
Okay, so we have actually partnered with over 30 media houses, including yours, and we allow phone-in sections. And so the phone-in sections will have people calling in, and once you call in, you qualify to enjoy from a free disinfection exercise.
Do you want to share the phone numbers?
We also have a number of listed orphanages and vulnerable institutions that already have qualified for the disinfection. Now we are partnering with 30 media houses and giving 100 slots per media house for disinfection. We're looking at disinfecting 3,000 homes, in addition to the list of vulnerable institutions we have.
Well, I was asking if you would like to share the number for people to call in.
Yes, so you can have an open session where you will give the media house number, that is your number, and then you do the collation for us. We don't want we want it to be coming from your side. So all our media houses are supposed to provide opportunity for people to phone in and qualify to enjoy this community campaign that we are doing for free.
Lola, thank you very much for your time and for the initiative. Lola Ashite there speaking for the Zoomline company, which is going out on a free fumigation campaign there. And we'll certainly be wrapping up our 2 hours with Let's Talk Showbiz, but there is more news at myjoyonline.com, and I'll urge you to log on, share our links with your friends or your social media connections. And my name is Gifty Ando Apia. Remember to wear your face masks, and remember not to be crowded in a tiny room with so many people, especially when they're not even wearing the masks. Many thanks for your time. We'll do this again tomorrow, I'm hopeful. See you then.